Just turning over to 6:37, and Dr. Hamel Kathri, the Chief Medical Officer for Dignity Health in the Central California Division, has been joining us ever since this pandemic really began to answer our questions and give us the latest on research and the latest on numbers across the country. Dr. Kathri, thanks so much for joining us again this morning, sir.
Well, good morning, Maddie. Thank you for having me.
Well, it's a new week. And let's just talk about where we are right now as a country. Last week, about 1 week ago, the Surgeon General said that we were looking at a really terrible week last week, that this was going to be our Pearl Harbor moment, and that the peak would have come and we would begin to see some changes this week. Where do you think we are? Do you think that that fulfilled itself last week and we actually reached the peak?
I think in some parts of the country we did. However, for example, in Los Angeles, their peak started late yesterday, early today. So they haven't even reached their surge. So I think it's premature to say we've reached our peak because different parts of the country are reaching it differently.
So what do you expect to see? And what does that mean that they are just beginning to see their surge in Los Angeles? What does that mean as far as new cases and new deaths and what we could expect to see this week?
So what we should expect out of Los Angeles this week is a rising number of cases and a rising number of people admitted to the hospitals. We're watching that extremely closely because we're about a week and a half behind Los Angeles here in Kern County.
So if we're about a week and a half away from our surge, what's our capacity like right now? Do you still think that we're going to have enough capacity in our hospitals as we're starting to see this uptick?
You know, we are constantly working on this capacity issue where we're trying to increase our bed capacity, especially ICU beds, by about 40% at each of our hospitals. So that's our goal right now. If we can do that at all of the hospitals in Kern County, I think we'll be fine.
And how are they right now? Are our hospitals inundated at the moment?
You know, some of our ICUs are inundated. The issue we're having a lot is nursing staff. We're actively recruiting ICU nurses currently. So that's where our shortfall will be, is our nursing staff.
Now, there's been a lot of talk I've seen on social media about whether California has some sort of herd immunity to COVID-19, and perhaps that is the reason that California is faring so differently than New York. This theory that was promoted by a man named Victor Davis Hanson, a senior fellow at Stanford's Hoover Institute, goes that the virus actually arrived in California much earlier than reported, like last fall. And I've seen so many people talking about this on social media saying, you know, I think I had a flu-like illness or a cough that went on for weeks on end, and thinking that perhaps they had COVID-19 much earlier than it was ever identified here in California. What are your thoughts on that? Is there any evidence that that could have actually happened?
You know, and that's the problem, is we don't have that evidence. We weren't testing at that time. If we did, if we had the testing, you know, we could be able to validate that. But unfortunately, you know, a lot of people had the flu last fall. So was it the flu? Was it COVID? It's really hard to determine without knowing, without having the testing to be able to verify it.
Well, one of the ways, obviously, is that antibody testing. We know LA is now rolling out antibody testing on a large scale. We now have a lab here in Bakersfield that is doing antibody testing. Who should go get this test? The thought goes that if we go get this test, we'll know whether or not these people have already had it, now maybe have some sort of protection from it, and it'll also have an effect on the mortality rate, because we'll know that people actually did have it, and we know that their outcome from it was positive. They survived. So what do you think? Should people go out and get this antibody test here in Kern County?
Well, I will let you know, as of last Thursday, and I didn't check on Friday, the CDC had not approved the antibody testing as of yet. So we are all waiting for them. They should come out with that approval already, either today or tomorrow if they haven't already. And I need to check that. But what we're telling people to do is, you know, there may be a shortage on those tests as well. So we're actually looking to test healthcare workers to see if they have immunity. That way we can get them back to the front lines. And that's what we're going to use it primarily for.
So you think that those need to be reserved for those people because that's what's actually going to help in this pandemic, to care for people?
Correct. Now, there's also a different way of when you check yourself with the antibodies is, are you able to donate plasma? You know, and that could be one of the reasons you may want to test as well. So if you've had a positive test, you may want to go in and get tested for this antibody, and if it's negative and you're 14 days out from your symptoms, you can actually go ahead and donate plasma, which will be life-saving to some of these other people.
And how is that going here? We know you talked about it a couple of weeks ago, the beginning of this trial and using the plasma from people who recovered.
Right. So we're actually asking people to come to the Houchin Blood Bank. If you've had a positive test and you're now 28 days free of symptoms, you can go ahead to the Houchin Blood Bank and donate. Now, if this antibody test comes to fruition, which, like I said, should within the next day or two, you can, and if you've had a positive test, you can go get the antibody test. And if you're 14 days out, symptom-free, have a positive antibody test, you can then also donate plasma.
Is this helping people, this plasma?
You know, there was a small study that showed it really did help people. So that's, one of the hopes. We're trying to grab onto anything we can right now.
Is it being used?
This trial in China did really help people, yes.
Is it being used yet here in Kern County?
It is not, and we have not started yet.
And where is that in the process?
We're still recruiting patients to donate plasma. And once we have the plasma, we're now reserving this for the really sick people.
Okay. Dr. Hemel-Kothari, we are out of time, but we have a lot more questions to get to. We will save those up for tomorrow morning when you join us once again, sir. You're a very busy man. We really appreciate your time.
Thank you so much, Maddie.
And we'll be right back.